So just a very quick thing about the Culture, Health and Wellbeing Alliance, for those of you who've not come to this event through our bulletin. We're a 5,000 strong, free to join membership organisation for everybody who's interested in the relationship between creativity, the cultural sector and health and wellbeing. We're funded by Arts Council England as a sector support organisation, and our vision is a healthy world powered by our creativity and imagination. We're an organisation that's driven by the collective power of our members, and we exist to amplify and support their work. Our members range from freelancers to people working in museums, libraries, health commissioners, and many members who are working for local government or in health or social care. We have 18 regional champions around the country. We've got a growing number of special interest groups, and we work in partnership with Lens, which is the lived experience network, who work to ensure that the voices of those with lived experience remain at the heart of the arts, health and wellbeing movement. We send out monthly bulletins, and we have a website that's full of resources, including on social prescribing. I'll share some links about us in the chat shortly, and you can read further afterwards. But I just wanted to put in a quick plug while you're all here. The Lens, the Lived Experience Network, are currently looking for directors as they establish themselves as a CIC. So I'll put the link in for that as well. And if you're interested, please do pursue that or pass it on to your networks. And that is all I'm going to say so that we can focus on the fun. So I'm going to pass over now to John. Thanks very much, John.
Brilliant. Thank you, Victoria and Hayley, for helping to put this together. And thanks to everyone for being able to join us today. We've been quite, we've not been surprised, but we have been still a little bit mildly overwhelmed by the level of interest in this programme. We'll come back to speak a bit more about that shortly. I hope you're all keeping really well wherever you are across the country or internationally, like Victoria, who is joining us from Johannesburg today, I think. I'm joining you all from quite snowy West Yorkshire, Hebden Bridge at the moment. So if I glaze over and peer out of the window, it's because I've been distracted by falling snow, probably. I'm in the house on my own, not expecting any interruptions. My partner's out at work, but it's not out of the question that the boiler cupboard behind me might swing open, or there might be a knock at the door, which is always the most simultaneously terrifying and exciting moment of the day as we all work under these strange new conditions. So hopefully I can just sort of shout out the window for people to leave a parcel on the doorstep or whatever. I'm going to share some slides with you all. What I want to cover is a quick bit of background on the Arts Council and how we've come to be engaged, not only in kind of the health and wellbeing sphere, but around social prescribing, how the National Academy has come into being, how we've been engaged with it, but then to really focus on thriving communities. Victoria gave me my introduction, but just so everyone's kind of clear, I'm the National Strategic Lead for Health and Wellbeing at the Arts Council, also cover criminal justice, homelessness, loneliness, and I also manage the core national policy team, so I wear a number of hats. But I've worked throughout my career for small, medium and quite large arts and cultural organisations out there in the sector, delivering, as you all are doing. So not just a kind of bureaucrat sat here in a tower. I know where you're all coming from, and I've been in the same situation. Not going to dwell on this, but just really brief context on the Arts Council. Just a reminder always that we're not just a funding organisation, which I think most people understand we are. We're the National Sector Development Agency for Culture and Creativity across England, and our remit stretches to include museums and public libraries, as well as the arts. We break our work down into these 5 area teams, although we have 9 regional offices. Tend to segment our work by art form as outlined on the screen, but with cross-cutting themes as well. And I think we're getting to the point where I think I can add to that slide health and wellbeing as one of the cross-cutting strands of activity as well. Our money comes from a mixture of Treasury money, granting aid, and money from the National Lottery. Okay, oh, wrong way. bit more on our footprint. Most of our money goes out on what we call our national portfolio organisations. These are the entities that get regular money from us on a 3 to 4 year cycle from organisations that get £40,000 a year from us. That's the smallest MPO award we make to organisations receiving £20 million a year plus, the Royal Opera House, South Bank Centre, etc. We make about 3,000 awards through our open programme of National Lottery Arts Council project grants every year, although that fluctuates with lottery revenues and other things. We are responsible for the over 2,500 accredited museums in England, the over 3,000 public libraries, and as the slide expands and expands, all of the formally and informally constituted voluntary arts organisations and the innumerable independent practitioners in our role as development agency. So onwards again to arts and health. Just a bit of background, because this has fluctuated for the Arts Council. If we jump back 12 years, this landmark speech by the then Secretary of State for Health, and we signed a joint compact between the Arts Council and the NHS in 2008. But a week after this speech was given, Lehman Brothers collapsed, global financial crisis ensued, and everything changed for us. And through 2010 and for the next few years onwards, we lost a lot of specialist capacity around health and well-being within the Arts Council. We ceased to have named specialist leads, continue to invest in the field more as a kind of legacy investment rather than anything that was kind of very, very deeply strategically considered. Keep going the wrong way on the mouse. Fast forwarding 10 years on from that point, a new moment of kind of alignment between these agendas, arts and culture, health and well-being. This speech by the now Secretary of State for Health, Matt Hancock, at the King's Fund Social Prescribing Conference, where again we've got a health minister talking really clearly about the role that the arts can play. Around the same time, we did this kind of 5-year evidence snapshot for criminal justice as well as health and well-being, to kind of look, where is the evidence base really strong at the moment? What are the gaps? I'm not going to read the slide out for time. I think we can share the slides afterwards, but that's just a flavour of some of the things we were finding through that work. Here's a flavour of other strategic documents over recent years that we think have been quite influential of our practice and sort of wider landscape in this field. Again, we're going to share the slides, so no need to scribble everything down. I just wanted to talk a bit about what we actually invest at the moment in health and wellbeing projects. So of our national portfolio organisations, 54 of them do specialist work. They do their primary work in the field of arts and health. We spend about £13 million a year on those. In terms of just their contractual agreements with us, another 64 MPOs do some work around health and wellbeing. I actually think it's much more than that. I think it's over half the portfolio now, but as it is in our funding agreements, we support formally another 64 MPOs who receive in total just over £70 million a year from us. Last year, we spent nearly £14 million on project grants that were focused on health and wellbeing. That's our open programme National Lottery funding. That's really exponentially increased, particularly over the last 4 years. That's more than quadrupled, and it almost doubled in a year from 18-19 to 19-20, so quite a strong upward trend. We fund CHWA as a national sector support organisation, as Victoria has alluded to. We've created an internal network of regional leads within the Arts Council and art form leads and other thematic leads. So there's 40 members of staff at ACE that play this health and wellbeing champion role now. So it's not just me wearing this national hat. Quick flavour of some of the national partnerships anyway that we've been forming with national agencies. Again, I'm not going to dwell on these, just a kind of an indication, and I'll keep moving. People may know that in February we published a new 10-year strategy for the arts in England. Let's create health and wellbeing for the first time in a major strategic document of ours has been quite strongly foregrounded amongst many other themes. We had intended to publish a delivery plan in March of this year. For obvious reasons, things were disrupted. We're now planning to publish a kind of initial delivery plan for the early years of the 10-year cycle at the start of next year. Important to say that this wasn't just a kind of an exercise of introspection for the Arts Council. It was primarily created from extensive consultation right across the arts and beyond, including education, local government, and of course the health sector. Again, I'm not going to read these slides out, but just a quick indication of some of the ways we mention health and well-being in the new strategy. So focus on some of the sort of specific benefits, for example, loneliness, mental health, healthy aging. I can hear someone has their microphone on. I can hear pens clicking. It'd be great if people could, just for now, remember to keep their mics turned off if they're not speaking. Just another slide, nearly there with these. I'll just keep rolling through. And in this one, particular acknowledgement of social prescribing as well as a field of practice. Quick acknowledgement, don't only fund CHWA, there's lots of regional and sub-regional partnership and support organisations for arts and culture and health and wellbeing across England. So if you don't know about those, if you're not engaged with them already, kind of seek them out, and we can help further signpost people to those after this meeting. So on to the meat of what we are here to discuss, Thriving Communities Programme. I should kind of hover back up quickly and say, so National Academy for Social Prescribing, which is the main driver behind all of this new charity that was created almost exactly a year ago, sort of incubated and created by NHS England with money from the Department of Health and Social Care. We were a founding partner to the creation of the Academy. They have quite a broad remit, but really it's about creating the partnerships at every level, local, regional, national, to make social prescribing work. It's about reinforcing the evidence base for social prescribing, finding and proliferating models of sustainable funding for social prescribing, and also building understanding amongst commissioners, policymakers, but also the general public about social prescribing as an important and legitimate route of, well, like a legitimate treatment pathway or care and support pathway for individuals and communities. So, take a sip of water quickly. The Thriving Communities Programme was announced on the 10th of November. It's quite broad and multi-stranded. There's this kind of national network element, which is called Learning Together, which includes things like webinars, action learning sets, development of a newsletter, just to build this community of practice around social prescribing. They've appointed 7 regional partners to really kind of bolster the work in each of the 7 NHS England regions. We'll talk about those in more detail in a second, the regions. There's a national research partnership to build the evidence base for social prescribing. There's also a connected strand of funding around NHS Charities Together. That's not something that people can bid for at the moment, but NHS Charities Together are distributing large chunks of what we can call the Captain Tom money, the money raised through the pandemic for the NHS, being distributed via sub-regional local NHS charities, particularly for community health and wellbeing, so in a social prescribing context. And there's more information on all of those on the NASP website. You can see the address at the bottom there. The fund itself, what is it? It's a 12-month fund. We've got £1.4 million for delivery to take place between March next year and March the following year. Most of the money has come from the Academy with their budget from the Department of Health and Social Care, but £250,000 of it is Arts Council money from the National Lottery. We're seeking to make grants of between £25,000 and £50,000, although we're encouraging grants at the upper end of the spectrum. Anyone whose mental arithmetic is very, very rapid will have worked out that could work out roughly 28 awards if we were awarding all at 58k, making up 1.4 million. A requirement of the programme is that we ask applicants to evidence 20% cash match on top of whatever funding ask they're making of the fund. We're seeking relatively even distribution across the 7 NHS England regions. Those are Yorkshire and the North East, North West, Midlands, South West, London, South East and East of England. It's not a very, very rigid requirement. We've got some flexibility around volume of applications we receive in different regions, quality of applications, and balance of sectors represented in the fund, as we'll come on to a bit more in a second. Important to say that it's not just us and the Academy. There are these wider partners, including NHS England, DCMS, Sport England, Natural England, etc., who are all part of this programme. So, next thing, what is it? What are projects actually expected to do? It's a hybrid ask that we're making of applicants. We're asking people to bring together the place-based partnerships that strengthen the infrastructure for social prescribing at a local level. We're also looking for projects to plan and deliver some community level activities and support that directly address patients and communities to build their well-being locally. Although the breadth of the delivery that we seek won't have to be as broad as the partnerships that we're asking people to create. We'll come back to that as well. We want every project to also, throughout its duration, be exploring ways to make both the partnerships and delivery in that locality for social prescribing more sustainable over the longer term, so that it's not a case of when the funding ends, everything just drops away. We want to create that kind of legacy of sustainable activity. Important to note that if anyone's read the guidance as well, you'll see there's quite a strong focus seeking applications that address communities that are most subject to health inequalities and very overlapping with that, almost a kind of perfect circle of a Venn diagram, those communities most negatively impacted by the pandemic. So, who will deliver? We're not looking for applications from individual organisations. We want partnership or consortia-based proposals that span across these different sectors that it mentions on the slide: culture, sport, nature, health, the wider VCSE. Every project, at least in terms of the partnerships that it brings together, has to deliver across all of those sectors. At application stage, we're asking every project to evidence a minimum of 3 core partners, and one of those has to be a cultural organisation. We get asked a lot about the separation between these two things. An analogy I've been using is if you're organising a party, your 3 core partners are you and your mates who are organising the party. The wider partnership you're bringing together are the guests you invite. It's who you get around the table in your locality to talk about social prescribing. I can see people nodding, so it's nice to think that that analogy works. We're also asking every application to be able to demonstrate support, contact with and support from a local social prescribing link worker. To go into this in a bit more detail, so applications have to be led by voluntary community or sector or social enterprise organisations. They could work across any of these sectors it mentions on the slide. So your application could be led by a cultural organisation, but it could equally be led by sport, community advice and guidance, environment and nature. Could be led by a health and care organisation, but it's important to stress that statutory partners, including local government, clinical commissioning groups, primary care networks, integrated care systems, etc., can't be the lead applicant. It has to be kind of voluntary community sector, not-for-profit organisations that are the lead applicant. Those statutory partners can be amongst your core partners or amongst the wider partnership, but they can't lead the application. As it says, every application has to demonstrate a commitment to work across all of those sectors in terms of who you bring to the table. Timeline. Very quickly, programme launched on the 10th of November, as mentioned. The portal opened, the applications portal on our website opened on the 23rd. It closes on the 8th of January. We're very aware this is a tight window with the ask that is being made. Partly, our ability to get the fund out earlier was disrupted by the pandemic. It would have been launched sooner. We had to get the programme to a point where we were making decisions and allocating funding within this financial year. It's just been a condition of the way the funding has come down. that's where we are. It's something we've all got to work with. We'll be making decisions jointly amongst all of the partners January and February, notifying applicants in March, and we'll be announcing the programme publicly in mid-March to coincide with Social Prescribing Day. Anyone who's applied to the Arts Council before will know this well, but important to stress for those of you who are new to us that Grantium, our applications portal, can take up to 5 days to register with, can take 2 days or fewer. So give yourself time to register on the portal to make sure you're not kind of caught off guard later on. Link there for how you access that. What we don't want are people getting in contact on the 7th of January saying, oh, our Grantium registration isn't through yet. How do we apply? That would be kind of too late, really. Last slide from me, I think, is just to acknowledge that there are other sources of funding where we can support activity and practitioners at this intersection. It's between health and arts and culture. It's a whole different presentation, and we did a different session for CHWA on project grants and developing your creative practice, but I just wanted to acknowledge them here, that those two programs both also exist and have recently reopened. First relaunched phase of developing your creative practice closed for applications a couple of weeks ago, will be reopening soon. Project grants is open on a rolling basis, and we have an allocation until April 2021. There'll be a new allocation after that. That's kind of it from me, Victoria. So shall I close the slides and we can go into people's questions, which is what we're really, really here for.
That's great. Thanks, John. Really helpful. Okay, there's a pile of questions. As you would imagine. The first one was about...
If we can't answer them all today, we're going to gather all the questions up, and we're accumulating FAQs all the time. We'll look to publish those soon. So.
Absolutely, yes. So we'll save the chat. We'll draw out key questions, especially the ones that we've not managed to get to. I think possibly one thing we could talk about quickly is link workers. There's about 3 or 4 questions about link workers. I know from having spoken to other organisations that this is a bit of a challenge at the moment. So one person has asked, what if your social prescribing link worker isn't in place yet? And in sort of in relationship to that, if you've got more than one CCG in your area, what's your advice in terms of approaching them? Sorry to throw you straight into the health side of things, John,
that's fair enough. And obviously it can be a kind of complex and uneven picture. Generally with link workers, the funding is flowing down through primary care networks, and they're often the organisations that are recruiting link workers, but not always, and they can be hosted by a wide variety of voluntary and community sector organisations. And we're always trying to encourage hosting of link workers in libraries or in art centres and those sorts of things. If your area genuinely doesn't have a link worker in place, I would encourage you to log that with our customer services team if you're definitely intent on making a proposal, but also to secure some kind of proxy support. So if not the link worker because they're not in place, acknowledgement of support either from the primary care network or from the other host organisation that may currently be advertising to recruit but hasn't yet recruited. That would be my suggestion.
Thanks. There's a couple, I mean, sort of in relation to that.
CCGs, sorry, Victoria. Perfect. So, and a question that's come up quite often to expand that more broadly is what constitutes a place for the purposes of this programme. We're not being prescriptive about that. We are asking for your proposals about, what would be a manageable unit of place, a valuable unit of place to bring those partners together to both create that infrastructure and to deliver activities. That might be on a kind of local authority or a CCG footprint, might be much smaller, could be 1 or 2 primary care networks or postcode areas. It could be larger, it could be across an integrated authority like the Greater Manchester Combined Authority or West Yorkshire Partnership. It could be, particularly if you're in a rural area, across a county, for example, if you are looking to target uneven provision of services in rural areas. Obviously, for a total award size of 50 grand, your proposal has to be realistic about the scale of what you're seeking to achieve. We would be looking to you to articulate to us why that was an appropriate footprint. And with CCGs and with border areas between different local authorities, if you can make a convincing case as to why your project works along that fault line, then put the proposal into us. Just what's a riff on that slightly, something I should have said in my presentation, Victoria, is we are trying to strongly dissuade gluts of applications all from the same place, separate competing applications. What we really want are fewer, higher quality, more unified proposals. Talk as widely as you can to your peer cultural organisations in your place, but also to those organisations that can play that kind of brokerage role, and that many others might be having conversations with around this programme. Your CCG, your local authority, your local voluntary community sector support network. Do everything you can before you put your application in to think about who else might apply near me, and to draw those applications together where you can. To reiterate, we're probably only going to make 30-ish awards, give or take. So if we get, you know, I don't know, my hometown where I'm from, if we got 10 applications from Wigan or 12 applications from the London Borough of Hackney, they're all setting off on the back foot, because it's a lot of competition for not a lot of available support.
Thanks, John. Sorry for my typing. I forgot I wasn't on mute. There is a bit of reticence, I think. Some people have come across with, sorry, going back to the link workers again. My only other suggestion would be to try contacting the National Association of Link Workers if you're getting really stuck. I don't know if you know of any other umbrella bodies that might be helpful in that instance.
Yeah, there are the local and sub-regional social prescribing development workers and coordinators at NHS England funds. They have put themselves out there as being able to have conversations about applications to this fund, although I think they might be regretting it slightly in terms of volume of inquiries. We can share their details and the details of the regional organisations that NASP have appointed after this session, if that's useful. But just something to add to that, Victoria, because of the timescales and because of the complexity of the ask that is being made by this programme, we're not expecting all of the activities and all of the partnerships to be new and starting from scratch. We envisage that perhaps in a large number, maybe even the majority of cases, it may be the case that there are already nascent partnerships that are looking to really accelerate their activity, broaden their scope and the range of participants. So it may be the case that if you're thinking, well, we're starting really cold, we don't have any of these networks right now, we're not in contact with the link worker yet, this might not be the right fund for you at this point in time. The other important thing to say is if you're looking to build your work and your engagement in social prescribing, that wider Thriving Communities offer, the Learning Together programme and the other strands may be a more appropriate first port of call for your organisation than this fund.
That is a really important point. Actually, in relation to what you were just saying, John, about what might already be going on with organisations, Sophie has asked if they're, I'm sorry that I'm reading your questions, it's just for speed. If we already feel we have a good programme to refer into, is it okay to focus on developing capacity and understanding within the referral system rather than paying for new content delivery that will take time to develop and then stop after 12 months?
That's a really interesting kind of nuanced question. Yeah, so we're not being prescriptive about the balance between the partnership building and the capacity building and the delivery of activities. We want every proposal to include both. If there's already ample provision in your place which doesn't need additional resourcing, that's amazing. If that existing provision might be further informed by the partnership work in community consultation that could be a part of your project, to make sure that groups that haven't been reached before are reached by them, or you know, that new kind of postcode areas are better addressed, for example. That would be great. What I want to emphasize is we're not looking for, something we want to break is this assumption that one of the great things about social prescribing is there's just loads of activities out there, they're being done anyway, the healthcare system can utilize them for free. We want to create a flow of resourcing for activities to happen. But if your proposal is around a place that is already well resourced for activities and the support can be better utilized in other ways, just be sure to describe that in your application, to frame the activities still as part of your application, but to talk about the balance of, and just to allude to one of the slides mentioned two kind of prototype activities that we have underway in Calderdale in West Yorkshire, which is where I sit at the moment, and in London. The project in Calderdale is particularly focused on bringing together the partners. They've hired a coordinator to do all of that work, to bring people together, not just in that local authority area, but across the wider West Yorkshire Health and Care Partnership. There is some funding for activities, but not much. The London project we have underway, which is with the Mayor's Office and the Healthy London Partnership as the umbrella for CCGs in London, is hardly spending anything on the kind of admin side. They've not really committed very much to new staffing or support. They are cascading resources to commissioning of new social prescribing delivery in the London boroughs of Southwark and Merton. And both of those are kind of legitimate, as long as your work, to say again, is both bringing together partners. To extend the analogy before of the party, you know, core partners are your organisers, partnership are your invitees. The activities might be who's doing the cooking, who's maybe kind of standing up and singing a song at the show, or doing the playlist or whatever. So think of it in that way, perhaps, if the activity withstands being, sorry, if the analogy withstands being extended in that way.
I've got what is hopefully a very quick one. Can you apply for this fund if you have already had some of the cultural recovery funds?
Yes, yeah, it's not, or even any other kind of Arts Council applications that are still in train. Those of you that are more familiar with the way that the Arts Council works, that sometimes if you're in recent receipt of a fund, or if you have an application already in with us, you can't apply for another fund. That doesn't apply in this case. Question just popped up, can MPOs apply? Of course they can apply. We really want them to apply, you know, amongst other cultural organisations. But it's important to say that with the cash match aspect, other Arts Council sources of funding can't be used as cash match. That's just a kind of technical requirement for us. So an MPO could use other trusts and foundation funding that they've accessed, or partnership funding from a council, or their commercial revenue as match, but they couldn't use their ACE grant. And an organisation getting project grant funding from us couldn't use their ACE grant. Some of these look like duplicate questions, but you know, as I say, what we don't do, we can.
Yeah, I'll just jump in about the question about who can lead the application. Somebody was checking, can local authorities apply as a lead? I think that's a no, isn't it? It has to be voluntary sector.
Yeah, they can't be a lead, but they can be a partner. Someone else asking, can a social enterprise lead an application? Yes, as long as they fit within one of those specified sectors.
Thanks, John. There was a question from Amanda, I think it was earlier. Will there be an evaluation framework and support? This is a
really interesting question. So those of you who've read the guidance will see that one of the asks we make is, how will you understand and evidence the impact that your work is making? So that's something that we're gauging at a local level with the individual applicants. Undoubtedly, there will be some consistent metrics that we ask applicants to report back on, which I'm sure will include things like you know, number of participants, number of partners engaged, We've not settled yet on a specific metric around kind of improved well-being or distance travelled. I think at a local level, we're asking you to tell us what might you use for those purposes, but we will commission an overarching programme evaluation that looks at some of these things as well.
Thanks, John. A question from Helen about where would be the best general source of information, do you think, John, in terms of finding out more about how social prescribing funding works, broader than Thriving Communities, just a general, how does this whole thing work?
Yeah, so there are some social prescribing pages on the Arts Council England website. Obviously, the National Academy for Social Prescribing has some really good stuff on there. There's some really good stuff on the NHS England website, King's Fund. There's quite a lot in all kinds of places. Perhaps Victoria, as part of the follow-up from this meeting, we can share some links for further reading.
Happy to, yes. We have, and I shared a link earlier to the one on our website, which does link out to quite a lot of those places as well.
Sorry, can I just follow that up? Is what I don't understand is if we were trying to establish a new, use the funds to set up a new social prescribing project, we work with people with learning disabilities, and they're who come in and carry out creative practice in our charity, but I don't understand, and it gets funded through their partly by us through trusts and foundations, but also through a direct payment. But I don't understand if we were going to offer something like that to people who haven't got a personal budget, how would you pay for that referral cost? I don't understand that part of it, if that makes sense.
Yeah. So, and obviously I just know what you've told me about the kind of context for your individual organisation, and you guys are all sort of specialists delivering in your localities. So we would expect, potentially some of the funding that you bid for, that you ask for from us, to be used to pay for the delivery of activities, and that could be, sessional staff costs, it could be venue hire, it could be, materials and low grade equipment costs for arts or sport or nature-based activities, for example. Are you asking, just to make sure I understand what you're asking, you're talking about the cost of the referral? Do you mean something other than the activities to be provided?
Beyond this project, if we wanted it to, establish something and then for it to continue, like where, I don't understand.
Yeah, so part of the, and I don't know if you've read, I don't know if you've had a chance, Helen, yet to read the guidance either, but one of the things that we're attempting to drive towards with this programme, and what part of the rationale for asking for 20% cash match, is we're looking for people to engineer ways of opening up longer term funding streams for this activity beyond March 2022. So I know it's a super challenging context for all partners, but the idea is that we open up a regular flow of funding for community delivery from the integrated care system, the CCG, the mental health partnership, primary care networks at very local level. In Calderdale, I mentioned that, that project was created just before the pandemic, so a slightly different context, but for 30 grand put in by the Arts Council, there's 70 grand being put forward by the council, the CCG and the North Halifax PCN. In the London project, 20 grand from the Arts Council has been tripled by equivalent contributions from the CCG cluster, the Healthy London Partnership and the Mayor's Office. So we believe there are local partners ready to invest in this kind of activity. That Captain Tom money from NHS Charities Together that I alluded to, it's not clear how that will be allocated yet, but that money is flowing down to local NHS charities for specifically community delivery rather than hospital delivery. So that is something else to explore and try and cultivate through this opportunity at a local level, if that makes sense. Is that okay? Is that relatively clear? Thank you.
Thanks, John. While we're talking at a sort of slightly broader level, there's a question from Kiz about communication and connection with diverse communities. Kiz, do you want to ask your question?
Oh, yeah. Yeah, thank you, Victoria. Thanks for all your information. So the question I had was about how do we in the UK set up our social prescription offer so that it's culturally sensitive from the outset, so that we never need to decolonise it ever?
Yeah, and you know, a big challenge for anyone working not just in community health and well-being, but any provision of services, including arts and cultural activities, is this idea of it all being soaked up by maybe not always the tranche of people that need it the most. And in health and well-being, we're obviously subject to the inverse care law, where the people with the greatest care needs and the greatest barriers to accessing care are often the least likely to receive that care. Those are really important kind of formative considerations for the National Academy for Social Prescribing. Obviously, this is a newer area of territory for us as the Arts Council getting involved in this field, but a really exciting one for us in terms of health and well-being activities explicitly oriented towards kind of public health. I suppose in terms of the partnership aspect, it's really interesting to reflect upon how proposals could integrate within that community stakeholders, community consultation, particularly in the target places or amongst target demographics, making sure that it's not just a load of artists, civil servants and sports coaches around a table planning what services are going to look like for that community, but that the voice of those groups that you're seeking to engage define the healthcare needs in that place and shape the activities that are there to be provided, and also help to define the legacy for that work and how it continues after the end of the project. I know it's kind of, I hope that doesn't sound too woolly, because a lot of that will be dependent upon the partnerships that can be opened up at a local level and who you can bring together. I know it's super easy to end up doing community consultation, stakeholder engagement and co-production in quite a tokenistic way. You sound like someone who has a more nuanced and kind of more detailed understanding of practice in this field. So we'd be looking for people to really seek to engage people in a meaningful way amongst the communities of practice that they bring together. Is that okay for now, Kiz?
Yeah, thank you.
Cheers.
Thanks, John. Steve Rimmer has a couple of questions. One, I think, was about the number of partners that you, or the different sectors that the partners cover, and then you just posted another one, Steve. Do you want to ask your questions? Not sure whether you're still there.
It's like a seance, isn't it? We're sort of summoning Steve, like the candles, yeah. Steve, do you have a microphone?
Maybe not. Shall I? I'll read out Steve's questions for now. Do jump in though, Steve, if the mic starts working. So the first question was, we're working with culture, sport and health, but unsure about natural environment. Will we still be considered?
Yes, absolutely. So, I mean, it's a kind of two-tier thing, isn't it? At application stage, you only need those three core partners. You need to demonstrate in your application a credible plan for over the duration of the work, how you will build those wider partnerships. So in effect, you've got a year to, I'm not saying wait 12 months, but you have the duration of your delivery to draw in those partners from across the full range of sectors demanded by the programme. But I'm just thinking about kind of Lambeth Southwark border, because I used to be the kind of ESF programme funding manager for there, and you've got loads of organisations like Trees for Cities, Groundworks, even the kind of local authority kind of parks service, all kinds of organisations in the London Borough of Southwark that could be involved around green spaces and natural environment. There's the London Wildlife Trust, many possibilities.
That's really good.
Also to say, Steve, you're from Southwark. If you're not already in touch with Matthew Cooper from Southwark, who I see also in the chat, please do make contact with him in the spirit of this bringing together partners from place, not to compete, but to unify their proposals.
So that was Matthew, sorry, Matthew who?
Matthew Cooper, I can see from the chat, who's one of the, unless you change roles, Matt, but I believe you're still one of the Arts and Culture officers at London Borough of Southwark, amongst other hats that you wear.
Okay, that's great, thank you. Yeah, so I think my other question was that we've sort of been working nationally for like 2 years, bringing together social prescribing and the arts, and we're sort of looking to focus on this project in Southwark. And yeah, so that was sort of hoping to build that partnership over 2 months after COVID. So I don't know whether to like focus our project funding on Southwark or to continue just nationally.
Well, I mean, this programme is for place-based delivery, so it's not for kind of work across a national footprint. It may be that the work that you have in mind might be more appropriate as an Arts Council project grants application, or an application to, there's a parallel National Lottery Community Fund, King's Fund social prescribing programme, so I'd invite people to have a look at that as well. You're not called Steve, are you? Is this your other half?
No, just on behalf of him, yeah.
Just wanted to check. All right, we can fit in a few more questions, I think, Victoria, right? Hopefully.
Just about, yes. Amanda from Nottingham Contemporary, you asked a question a while ago about services needing to be free at the point of access. Are you still around?
Yep. I think it's sort of been covered. It was really about sustainability. I was just thinking about, obviously not the full cost of delivery, but whether some of the cost could be sort of passed on to participants, and either that be paid for directly or through, kind of personal budgets or, whatever.
Important question. Definitely accessing personal budgets. Micro contributions from participants is a really interesting one. Obviously, with the focus of this programme, particularly on communities that may already face barriers to accessing services, experiencing health inequalities impacted by the pandemic, you don't want to be creating undue barriers. Possibility of kind of sliding scale or a hybrid offer where those least able to pay don't, those more able to pay maybe pay £2 a session or whatever. You know your local context and you know your service users. That is for you to formulate an offer to propose to us. Is that okay? Brilliant.
Thanks, John. I'm just scrolling through rapidly. If you pick any up.
Do that. Quick question about libraries. Library services that are within the local authority can't be a lead applicant, but they can be a partner. An outsourced library service delivered by a trust or other entity, as an increasing number are, could be a lead partner. I know that sounds a bit confusing. If you're from a library service, we're doing a dedicated session on the fund next Thursday morning, I think. It's about to go out in the Libraries Connected newsletter. So if you're from a libraries background and want to get more time to get your head around this, look at the Libraries Connected newsletter and come to the session next week if you can. That will also be filmed.
Sorry, I was just going to say as well, John, there's also another question from an NHS. It's not an NHS project, it's Penny. I don't know if Penny's still with us, but she was asking if they would be able to apply as a department that work with the community.
Yeah, we're in a very strange situation that we are an arts and health team. We belong inside an organisation, but our funding is not from any NHS sources. It's actually from our main charity and other grants and things that come in. So we very often work with the community and with inpatients and with visitors and with staff. So everything we do is based in the creative realm and in arts and health specifically. It's not healthcare delivery, but we often get stuck because we're not officially classed as a cultural organisation, yet we're not a health authority funded service. So
you're a charity working in health and care?
No, we're not. We're funded by our local charity, which is Stars Appeal, but we're not, our little team of 2.3 human beings is not classed as an actual charity in its own right. Neither are we a social enterprise, but at the same time, our service isn't funded by the NHS organisation that we as employees sit inside of.
Right.
And we've been doing this 20 years, so it's really frustrating that...
With 1 minute left, come into our customer services line with that specific inquiry, because I think I need to unpack it more and give you a more detailed answer. Sorry about that, Penny, just the clock.
No, that's all right. Thank you.
Thanks, John. We are on 2:59. Thanks so much, everybody. I feel like there are still about 1 million questions. So you're very welcome to get in touch with us at the Alliance. We can answer some questions, I think. And as John said, what we're going to do is take the questions from the chat and have a look at them. And John, I think you said you were going to be trying to sort of compress some of this into the FAQs, and that'll be published on the Arts Council website, is that right?
Yeah, and we can make sure we email stuff out to people who registered for today, Victoria. And I've not asked Victoria or Hayley about this, but we might, just to gauge demand and our own capacity, I may ask Victoria if we can email out a kind of micro survey, just gauging people's intent to apply as well. So really, really appreciate everyone's time today. I hope this has been kind of useful. I hope it's not, I'm aware this is a super complex program with a big ask and a lot of barriers to participation. What I don't want you to feel like is if it feels too far away for you to apply to this, there are lots of other ways for your organisation to get involved in this area of work. And again, we'll be cascading this stuff through the kind of follow-up from Hayley and Victoria. This is about the kind of communities of practice that we're building. The 30 odd projects that we fund through this will almost be kind of exemplars that are used to proliferate practice more widely. So that's kind of what we're seeking to do. We don't know if there's going to be later iterations. Everything for all public sector and many other funders is a bit uncertain in terms of future funding envelopes, but what we can say is that ourselves and all the other partners are really committed to continuing to build this area of practice. So thanks again, everyone. I hope you keep well through these weird times. I hope you all have good Christmases. I'm looking forward to reading the applications that come in, although hopefully not too many for my own kind of fraught nerves. And yeah, just keep in touch with us and with CHWA, and we'll see you all soon. Thank you.
Thanks so much, everybody. Thanks, John.
Cheers. Bye-bye.